name is Stephanie Stamas, and I'm a physical therapist here at Beyond Basics PT. I'm happy to announce that I am currently 8 months pregnant. I'm so thankful because I've been feeling pretty good throughout my entire pregnancy. But as my abdomen's getting bigger, one of the things that I've started to notice is some rib pain. So as my belly has been expanding, my ribs actually need to expand to kind of get up and out of the way to create more space for the baby. And so as these ribs have been moving, I've been getting some radiating pain across my upper abdomen and some sharp pains in the ribs. Lucky for me, I work at a PT clinic. So I just started seeing one of my coworkers, Jessica Babbage, for treatment for my rib pain. Let me show you what she's been doing.
Here you can see Jessica Babbage, a physical therapist at Beyond Basics PT, checking the mobility of my rib cage. First, she wants to check the mobility with breathing. She's assessing at the upper, middle, and lower aspects of the rib cage to see which segments are moving and which ones are not moving with normal inhalation and exhalation. Then she can check the actual mobility of my rib cage. First, she wants to check the lateral movement. How well does the rib cage open and close? By doing this, she side bends me to one side and checks how well the rib cage can close on that side and then open on the other side. And again, she's going to do this in the upper part, middle part, and lower part. She can actually localize the assessment even more by taking the rib cage into a diagonal quadrant and again checking where the mobility is most restricted. Here on me, Jessica found that my left lower ribs were the most restricted area, so this is where she decided to start her treatment. Here, Jessica is using my pelvis to further assess ribcage mobility because it mimics how the ribcage moves with breath and function. She is also moving the shoulder blade or scapula to assess for structural dysfunction in the way the shoulder blade can stabilize onto the ribcage. After using the pelvis and shoulder blade to determine which region and movement pattern is most restricted, she starts to treat out the biggest restriction using breathing and functional movement patterns. My left lower rib cage has a hard time moving down and back, so Jessica is using a PNF pattern called contract relax to free up the restriction and enhance my mobility in the lower region of my rib cage. Once she has cleared this region using movement patterns, she can now look more specifically at ribcage excursion with inhalation and exhalation. Typically, it is best to treat into exhalation first to make sure the ribs can gain full range of motion prior to training inhalation. To improve inhalation, Jessica is using a quick stretch technique to gain more opening mobility. If you are pregnant and you are experiencing any aches or pains, our highly trained physical therapists would love to help you. Please check out our website at beyondbasicspt.com to book your appointment.